With semaglutide treatment, it has been amazing for weight loss. We've never had a product like this that was a non-stimulant that was so effective. There were 2 clinical trials that were done over the past several years. The first one for Wegovy from Novo Nordisk. The average patient on Wegovy lost about 15% of their body weight, or about 30 pounds. There was also a trial from Mounjaro, also an injectable. The second clinical trial was done by the makers of Mounjaro. Their average patient lost approximately 20% of their body weight, or closer to 50 pounds. Here at Plaza Aesthetics and Wellness, we do use generic semaglutide. We're not taking medication away from diabetics that are on Ozempic. We utilize compounding pharmacies that are FDA regulated. We do provide the highest quality product for a patient. I will say that, in the clinical trials, most patients, they often had to get to escalating dosing, kind of the higher milligram dose, until they were seeing weight loss. We're not necessarily seeing that with our patients. We've been prescribing semaglutide for about 1.5 years. I've had over 100 patients, and our patients usually in the first few weeks are losing usually about 1 to 2 pounds a week is what we would expect. We don't want our patient to have massive weight loss. We would expect them to lose about 1 to 2 pounds a week, still eat a very well-balanced diet. They're seeing myself, my nurse, our registered dietitian, and we offer a very comprehensive weight loss program. So the name brand products like Wegovy, which is FDA approved for weight loss, is produced by a large pharmaceutical company. When product is either difficult to get a hold of, where the supply just can't meet the demand, or the product is at least 20% different than the original molecular structure of the original product, it is safe and it is legal for these compounding pharmacies to utilize generic semaglutide. We really like the generic product, and the reason is it's much more easily accessible right now. Unfortunately, the low doses of Wegovy are very difficult to obtain currently, and we're in November of 2023. From the compounding pharmacies, when we receive the medication, we are able to very slowly increase a patient's dose or titrate their dose. When you see the pens, if we were to prescribe a patient branded Wegovy, there are 4 pens, so 1 a week for 4 weeks, and then the dose doubles. And then in the next month, there's 4 pens, and then the dose doubles. By utilizing generic semaglutide, we are able, based off of the patient's, their side effects, the amount of weight they're losing, we are able to either escalate or de-escalate the dosing, and we're seeing our patients weekly, so we're able to really tailor their dosing for maximum amount of weight loss, but minimal side effects.